Hi, my name is Timothy Swartz. I'm a rheumatologist here at the Arthritis Center of Michiana Spine located in Kalamazoo, Michigan. One of the things that people often suffer during their lifetime is low back pain. And that can be due to degenerative arthritis, degenerative disc disease, and osteoarthritis in the spine. And that would be best treated by therapy and by seeing someone such as Dr. Drew, a physiatrist who specializes in the treatment of back disorders. There are some people, however, who have a type of inflammatory back disease called spondyloarthritis. The prime example of that is ankylosing spondylitis. And this is a group of diseases that is more common in men and can present actually at a younger age, maybe as young as the 20s. There's a little difference in how it presents as opposed to degenerative back disease. With degenerative back disease, activity usually makes it worse and you feel best after rest. With the inflammatory back diseases, usually you'll have more pain when you first get up, and activity will actually improve it, at least to a certain point. And again, it usually presents in younger people. Now, even though it has a male predominance, women can get it too. And sometimes there's evidence of peripheral arthritis, that is arthritis in the feet or knees, along with this inflammatory back disease. The features of it are, again, the stiffness and back pain that improve with activity. But when we do radiographs, we can see that you make extra bone formation where you actually fuse your back. That is, bone will grow between the vertebrae so it can move less well. Usually it'll start in the very lowest part of the back, in the sacroiliac joint, so there'll be a lot of low back pain starting. And then it may move up into the lower back, the neck, and even the mid-back can be involved by this. The radiographic evidence, that is the x-rays, show again this evidence of what we call syndesmophyte formation that causes the vertebrae to be fused together so they can't move. Also, what may happen is your sacroiliac joints may fuse. For men, that doesn't mean a lot. In women, that would affect your ability to give birth to children, as the pelvis normally expands during childbirth. There are some other unique features to these category of diseases in that you can get eye involvement with uveitis. A lot of times people will have some eye pain and redness, see an eye doctor, and they'll tell you you have arthritis of the eyes. And this usually means that you've got some inflammation of your uveal tract, which is a part of the eye that can be associated with this group of arthritides. You also can get inflammation where tendons insert into the bone, which we call an enthesitis, and you can get what has commonly been called sausage digits. That is where the whole finger or toe will swell up, and this has a fancy name of dactylitis. So these are all features of these spondyloarthritides that we look for in addition to the back pain and inflammation. Our evaluation of these includes an examination, in which case we'll look at all your joints, but especially measure how well your spine moves. On the laboratory side, we'll do blood tests that look for evidence of inflammation. Most especially, there's a test called the C-reactive protein, which is high and suggests that there is an inflammation going on that we see a lot with this type of arthritis. Once the diagnosis is made, we need to evaluate how severe it is to know what kind of medications to use. If it's just peripheral joints like the hands and feet, we can use some of the same drugs we use to treat rheumatoid arthritis. However, if there's significant back involvement, some erosions, that is, some eating away of the bones, or else some fusion, we need to use the newer biologic agents. Now, these are usually antibody molecules that are directed against inflammatory chemicals. They've been advertised heavily and include the drugs that you see a lot: Humira, Enbrel, Remicade, Cimzia, and Simponi, as well as some other ones as well. So a lot of times we'll need to move to one of these more potent medications to treat the inflammatory back disease. We need to evaluate you beforehand to make sure there's no evidence of infections, as infections are a very major concern when we use these kind of drugs. They have been very, very helpful, however, in reducing disability, reducing pain, and keeping people quite functional. The other important aspect of treating these disorders is therapy. So we'll also often have people see physical therapists, as keeping your back moving, doing a lot of stretching can help somewhat with the progression and certainly keep people more active throughout their lifetime. These diseases used to be very, very hard to treat, and people would have significant deformities later in their life. With the use of these new agents, we're quite hopeful that we're going to cut down on that. We'll make life a lot better and make people more productive.